I got never mind.
And welcome, guys, to My Health Matters. Um, my name is Shay Brown, and welcome to our special edition of Prostate Cancer Awareness Month. We have a special panel with us today. We have urologist from Cleveland, Ohio, Dr. Randy Vince Jr. here with us. That is going to be our specialist today to talk to us about prostate cancer. We have our licensed therapist, Arnisha Woods, who is going to talk about some of the issues that our men, mental issues that our men go through that deal with prostate cancer. And we also have two gentlemen that have had issues. One that may have had elevated prostate levels, and one person that may have actually had prostate cancer. And we're going to talk about those issues today and maybe bring some light to people that may have had questions about prostate cancer, some of the signs and symptoms, and hopefully we may be able to save a life, maybe save your own life. So we want to introduce the panel. I'm going to start with myself. Those that do not know me, my name is Shay Brown. I am a family nurse practitioner, plant-based nutritionist, personal trainer, obesity management specialist, and I am a cannabis medical provider. I am the CEO and manager of Fit for Life. I started this podcast because I wanted to bring awareness to patients and people that may not pretty much have a good, clear understanding of chronic illnesses and diseases. And we all know that we do go meet and see our doctors regularly, and sometimes we don't. Okay. But we are giving you the opportunity to have that chance to be able to ask questions to our panel of healthcare professionals. And then we have a panel of people that are speaking for the public. People that may have had those type of experiences and that can relate. You may be able to relate to the public speaking in your behalf. Okay, so I'm going to turn the next panel over to our licensed therapist, Arnisha, so she will be able to introduce herself and be able to let you guys know about her credentials.
Good evening, everyone. My name is Arnisha Woods. I am a licensed clinical professional counselor, and I currently practice in a private practice, and I have a master's degree in counseling and a master's degree in forensic psychology.
Thank you so much, Arnisha. And we are going to turn the panel over to Dr. Randy Vince.
Good evening, everyone. So I'm Dr. Randy Vince. I'm based in Cleveland, but I'm a native of Baltimore. So it was always a pleasure when Shay reached out for me to hop onto this call and this webinar. I graduated from Towson University. I have a master's degree in bioinformatics and computational medicine from University of Michigan, did medical school at Louisiana State University, residency in Richmond, Virginia at Virginia Commonwealth University. Also did a fellowship in urologic oncology. So I specifically specialize in surgical management of prostate cancer, kidney cancer, and bladder cancer, and also at the University of Michigan. And I recently accepted a position as an assistant professor in urology here at University Hospitals and Case Western Reserve University in Cleveland. And I'm also the director of Minority Men's Health.
All right. Okay. We're going to turn the panel over to Chauncey Whitehead.
Good evening, everyone. My name is Chauncey Whitehead. I'm a certified fitness professional, personal trainer, and an overall health activist within our community, Baltimore community. And also, I'm from Ohio, but based in Baltimore, Doc.
Damon West.
Hi. Hello, everyone. My name is Damon West. In 2017, I was diagnosed with prostate cancer. In 2018, I chose to get the surgery to have my prostate removed.
Okay, so we are going to start off with prostate cancer. We all know that prostate cancer is what we call a silent killer, and which is one of the second leading causes of mortality in men in the United States. Um, Dr. Vince, do you want to shed some light on that?
Yeah. So, typically when I'm counseling patients, specifically around prostate cancer screening, I counsel them that prostate cancer, in terms of the signs and things you may notice physically, is no different than, hypertension or diabetes. And I say that to say, most of the time you won't feel any physical effects from prostate cancer. And by the time you do, it's usually pretty advanced. So, that kind of hones in on the reason why getting screened for prostate cancer is so important. And the other thing that I think is really important for men to know is that prostate cancer typically behaves a little bit different than most other cancers that we know and we talk about on a regular basis. And I say that to say, when we catch prostate cancer early, and it's confined to the prostate, it's very treatable, and the chances of dying from prostate cancer drops significantly after you have treatment for prostate cancer.
So, if you had someone to come into your office and you were doing a history and a physical on them, I mean, you and I, we both do history and physicals on people,
Mm-hmm.
and you ask them, I mean, do you have a family history of prostate cancer? And the gentleman tell you, I really don't know a history
Mm-hmm.
on, my father. I really don't know my father. And, we normally start screening. What's the normal age of screening? And if, that age is, I mean, say 50 and he doesn't know, I
Yeah.
mean, what would you recommend?
Yeah. So, I think this is part of the problem a little bit when it comes to prostate cancer screening, because you have so many different organizations that have different age recommendations. And so the scenario you just laid out, I actually fall into that scenario. Like I lost my dad suddenly when I was 12 years old. So I don't have him to say, hey, did you have a history of prostate cancer? He was 36 years old when he passed away. So for those men, I typically say, and myself included, to start at least 45. There are organizations that recommend starting screening at 55. Some, the American Cancer Society just started recommending, I think, at the age of 40 for Black men. So, it's been across the board. It's kind of everybody's putting out different recommendations. But for me, typically, I say, if you don't know your family history, start at least at 45. If you do know your family history, then you want to at least start 10 years before whoever your family member was that was diagnosed. So if it's your dad, your dad's brother or something like that, and they were diagnosed at, let's say 52, then you might want to start at 42. So, so at least 10 years before that person was diagnosed with prostate cancer.
That's good information. So, doing a history and exam, um, what are some of the things that um, may be contributing factors to someone that has like prostate issues?
Mm-hmm. Yeah. So in terms of screening, typically what we do is we do what we call a prostate specific antigen test, which is a blood test, as well as a digital rectal exam, which is where you actually feel the prostate. And I always like to tell everyone that the prostate feels like a rubber ball. I don't know if people played jacks when they were growing up or something like that, but it was like a hard rubber ball in that game. And so that's what the prostate feels like. You could push on it and it bounce back. But if you feel anything that's like a pebble on the surface of the prostate, like a little small rock, then that's concerning for prostate cancer. Um, like we talked about in terms of signs and symptoms, those things don't typically manifest until later on in the disease process. So, most of the time when we're screening for prostate cancer, that's not something that most men have. it does happen, but that's not in the majority of situations. Other risk factors for prostate cancer, we talked about family history. Um, Other things include, things like smoking, obesity, diseases that are related to metabolic syndrome, so like hypertension, diabetes, and those types of things. So, I typically, again, think of, and I might be a little bit out of the box when I come to this, but I think of prostate cancer as a chronic disease, meaning to say, it's something that develops over time with different exposures and lifestyle behaviors, in addition to having these genetic components from a family history.
Absolutely. So when you say there is we check the PSA, which is the prostate specific antigen,
Mm-hmm.
and the digital rectal exam, a lot of men might say, wait a minute, digital rectal exam. I'm not sure about that. Do you do both at the same time, or do you just do the PSA, which is just drawing blood levels?
Mm-hmm.
And if that comes back abnormal, then you would do a digital rectal exam, or do you do both at the same time?
Yeah, so I do both at the same time. And the reason is because, there are men who have significant prostate cancer, but that prostate specific antigen or PSA level is not elevated. And the DRE is a way that you can pick up on it. But if I'm being just blunt about it, I'm a black man. The last thing I want is somebody sticking their finger up my butt, like if I'm being honest. And so that's a lot of the times when I hear that from men, it's like, hold on, doc, like you mean to tell me you gotta put a finger up my butt? Like, I don't know about that. And, in those moments, we kind of just have a real heart-to-heart conversation, because it's not something that most men are going to just, hop on a table just to have done. And I understand that. But, one of the things that I'm always very cognizant of as a black man, and specifically when I'm talking to other black men, is we're dying at, rates much higher than any other race, right? And it's from preventable diseases and preventable deaths. And so for me, that's something that I really hone in on when I'm talking and counseling my patients. It's like, look, which one is more important to you? Me taking 10 seconds to do a digital rectal exam, or you being around another 30 years to be with your family and loved ones? And most men will say, I want to be around for my family and loved ones.
So just for clarification, transparency,
Mm-hmm.
whether their PSA levels are elevated or not, you will definitely do both at the same time.
Mm-hmm.
Okay. All right.
Let me just caveat that 1 second. The only way I will not do a digital rectal exam is if I have a man with significantly elevated PSA levels, and I'm going to get a MRI of that prostate because I know I want to go ahead and biopsy that prostate. So if I got to do all of those steps, I know I would end up doing a DRE probably during the course of doing a biopsy. So that's the only time I will omit doing a DRE in the office. But anybody else, like if I'm on the fence or if we're just doing the regular screening, I'm going to recommend doing a DRE.
So I heard you mention that, we are at the higher rates of dying of those type of those cancers. Why are we at the highest risk? Why would you say that?
I feel like we can have a whole webinar on this. So, we
Chauncey, I you see smiling, and I'm gonna come to you on that one, Mr. Whitehead.
Often we talk about social determinants of health. That's like a buzzword nowadays within healthcare. But I mean, Black people, I'm gonna just set prostate cancer aside for a second. We have less access to healthcare. We're more likely to be uninsured or underinsured. We receive lower quality of care compared to white folks. And then because of the insurance and access to care, we also don't really go in for preventative medicine visits, right? So that's when those screenings will take place. So that's one, sit that all in a bucket, and I could throw in poverty, racism, all of those things into that bucket. Then you look at prostate cancer specifically. Black men are less likely to be screened for prostate cancer. When diagnosed, they're less likely to receive the standard of care treatment, less likely to be enrolled on clinical trials, which actually help determine the standard of care treatment. And so when you combine all of these different things along the whole continuum from before you're diagnosed to when you're diagnosed, how you're treated, all of those things add to Black men being twice as likely to die from prostate cancer as white men.
Mr. White, did you want to touch on that, sir? The same question I just asked him.
Yeah, I agree with Dr. Vince, and believe it or not, sometimes your perception is reality. Some men have even told me, even as it relates to prostate cancer and the exam, the rectal exam, they mention they go back to Tuskegee. Sometimes within Black men, we have this distrust of the health system. We can ignore it or we can address it. It's true. When I try to encourage men to get to go to the doctor to get a checkup, then when they reach a certain age, you want to make sure that you get your PSA, your exams, that type of thing. Typically, a lot of them my age. I'm a 60-year-old Black man. When I was in my late 40s and early 50s, the only time I'm going to go and I'm going to get that rectal exam is if something is really bothering me. It's not part of the what I would say your annual physical or annual checkup. I believe, Doctor Vin, we need to start. We have to try to encourage men to start going to get annual physicals. So by the time they reach that certain age or they have a family history, they're already conditioned to go into the doctor and we develop a little trust. But I agree with everything that Doc said, and have to address that.
So, some of the signs and symptoms. I want to touch on that a little bit. Damon, what made you go get screened? Because we have some signs and symptoms. I mean, we have from nocturia, frequency, getting up, going to the bathroom at night, urinary frequency during the day, dysuria, difficulty urinating, stop going. And I ask my men all the time, do you have a problem initiating a stream? What is that, Doc? Do you have a problem and you stand there at the toilet and nothing comes out and you're trying to initiate a stream, nothing comes out? Or do you have your blood looks orange or it looks pinkish? Or do you feel tired? Do you have bone pain? Have you lost weight? I mean, what prompted you, Damon, to go to get yourself checked out by the doctor?
For me, I didn't have too many symptoms. The only true symptoms that I can remember was frequent urination. But the main reason was my brother, my twin brother actually. He was diagnosed with it before I was,
Mm,
and he was he didn't have the cancer didn't spread that much. So basically, he was what they called a on the watch list.
mm,
And basically, what that is, the doctors they just watch and see how big the prostate is actually growing. And since he um, was diagnosed, I said, okay, let me go get checked out. And when I did, um, they did a PSA they did a PSA test and they saw my levels was extremely high. I think my numbers, and the doctor can correct me if I'm wrong, was like around the 10-12 range.
mhm.
So if your number's that high, um, that's sure signs that you have something's wrong with your prostate. And normally at that point, that's when they make a decision to um, do a prostate test on you.
Mm-hmm.
So, and that with the constant frequent urination and the PSA numbers, which led to me finding out that I had prostate cancer.
Okay, so when you say that your brother called you and said, "Hey, look, Damon, I have prostate cancer," how did he know to get himself checked out?
Um, I guess he had the normal symptoms, urination, frequent urination. Um, his PSA numbers were a little high too. If I can recall, I think his numbers were like I think his number was like 5 or 6 at the time. And with the frequent urination, they did they finally did a biopsy on him, which and made him said, okay, you show signs of prostate cancer, but it
And,
didn't spread that much.
mhm. And what does he mean when he says the watch list, Dr. Vince? Is there like a number of prostate levels that
Mhm.
indicates a watch list?
Yeah, that's a great question. So, typically, when men are diagnosed with prostate cancer, I like to think of it in putting patients into two bins, right? And
Mhm.
the reason why we can say this is because, you know, if you are a man and you're blessed with longevity, the chances are that as you every year that you age, you are at increased, even a higher risk of prostate cancer.
Absolutely.
And so, we not to get too much in the weeds of like the research and things like that, but they have done autopsy studies of men who lived to be 90 years old that died from some other reason. And when they looked at the prostate of those men, they found out the vast majority of them had prostate cancer. Prostate cancer behaves like, and we mentioned this a little bit earlier, can behave a little different than other types of cancer like lung cancer, colon cancer, those types of cancers. And the reason I say that, and I mentioned the two bins, is because for men with what we call low risk prostate cancer, it's typically not aggressive, and it's not threatening to a patient's health. And so we can put them in one bin and we can do what we call active surveillance. And within
Mhm.
active surveillance, what that means is we are checking for progression of the cancer to see if it shows any signs of spreading, or growing or becoming more aggressive. If it doesn't, we continue to do the active surveillance where, we'll check the PSA numbers. You may get a biopsy every so often, or you may get a prostate MRI.
Okay.
So again, that's for men with low risk prostate cancer.
Mhm.
And then the other bin are men who, have more significant prostate cancer, where the prostate cancer will behave a little more aggressively and potentially can become threatening to your health. And so for those men, those are the men who we recommend treatment for.
Mhm.
And even within those men, we also know based off research, if we did nothing, most of them would not succumb to prostate cancer for at least a decade, which
Mhm.
is unheard of for, like, if lung cancer, if somebody's diagnosed with lung cancer and you do nothing, probably maybe a year and a half they might survive before, they might succumb to that disease. And so, those men typically, that fall in the bucket of needing treatment are the ones who we can spare them, um, prostate cancer being any threat to their health. And that's also the reason why after a certain age, we don't even recommend screening for prostate cancer, right? Because if your life expectancy is less than 10 years, it
Mhm.
doesn't make sense to be diagnosed and then treated because, like I said, if we don't do anything, we know it won't cause you any health problems for at least a decade. And if your life expectancy is less than that, then it doesn't make sense to even start screening and looking for anything.
Mm. Jeez. Arnisha, our men, our African American men, what are we going to do with them? They are definitely going through some mental issues, especially when they are diagnosed with prostate cancer. They don't talk about things. I can only imagine things that are going on in their heads. Some don't seek counseling. Mm. How do we get to them? As
Well,
a medical provider, what suggestions would you give to us as our best approach to them?
I think one, we have to work on ending the stigma around health in general, especially for our brown men, right? And open up the conversation, a dialogue such as this, right? How often do we see a panel full of African American men who are just talking about health, and especially something so personable? And then normalize what comes after. Normalize that there may be times where you are experiencing some after effects of the prostate cancer and the treatment, right? And your feelings matter. You don't have to sit in depression. You don't have to sit in anxiety. You don't have to sit in shame. You don't have to sit in isolation. And the more people that you surround yourself with in those during those times will give you the support that you need, so that you can either talk to your loved ones or talk to someone like myself, so that we can start the conversation, not even just about the prostate cancer. That can come later on. Let's talk about how you're feeling, because your feelings matter. And then how does the diagnosis of prostate cancer contribute to that?
Absolutely. Absolutely. Um, Chauncey Whitehead, when you first got the news that you had elevated prostate levels, can you take us through your mental, sir?
Wow.
Hmm.
It's like what Doc was talking about. You have those two different bins, and with men, we tend to compartmentalize things. And when I was told I had elevated levels, I was like, okay, well, what does that mean? you know, what does that mean? I don't have prostate cancer, so I said to myself, I'm just going to keep it. I'm going to keep it in. I'm going to be all right. I'm going to listen to the doc. I'm going to, if I do have cancer, then maybe I'll talk. I was going through a whole lot of emotions. I tried to keep it in, but then I noticed that through the process of not talking to anyone about it, or as the doc talked about the two bins, the problem is if men are in that waiting stage or in that low category, we don't talk to anyone. Sometimes we don't even tell anyone if we do have prostate cancer. So it's difficult because you're like, well, how do I share the information that I have high PSA? I don't want nobody feeling sorry for me. I'm feeling sorry for myself. And so men, we tend to talk ourselves out of having a conversation about how we're feeling. I felt that I wanted to talk to someone, but I didn't think they would understand because I did not know if I had prostate cancer. I don't have prostate cancer. And, I don't want to act like I'm whining or I'm crying or, oh, it's me. I know that's not the way to think, but that's the way I felt. And I'm pretty, I said, if I feel that way, there must be other men that feel that way. That even during the waiting process, who do you talk to? Do we talk to anyone? Would they understand that? Well, your PSA, they ain't that high. You're gonna be all right. So then you kind of keep it to yourself, as I did. I just kept it to myself, and I want to try to get men that if you're in that process and you get notified that you have an elevated PSA, but we're not sure, we have to do these other tests, that it's okay to talk to someone. To talk to someone. Holding it in is really not a good thing. And I can tell you that wasn't a good thing as it relates to me.
Thank you. How about you, Damon? Damon, how about you?
I'm sorry, what was the question again?
How about you? How did you, I mean, what were your emotions when you found out that you had elevated prostate levels? Were you going through like a whirlwind of emotions?
A whirlwind, I would have to say yes. When I first found out, um, well, when we got the results back and the doctor said, hey, I need you to come in the office and I need you to bring someone with me, bring someone with you. And when he went over the results and he told me that I had prostate cancer, everything after that, I blacked out. I was just sitting there going through, just thinking about, wow, how can this happen to me? How did this happen to me? Am I going to die? when am I going to die? I mean, when you hear the C word, I mean, basically you just think, okay, you're basically on your deathbed. And you always hear about, okay, well, they got treatments for this, treatments for that, but treatments didn't really fall into my mind at the moment in time when I was sitting there. I was just thinking about um, my kids, my family, basically just, okay, how long do I have to live?
Mhm.
And you going through this emotional roller coaster, just sitting in the doctor's office, and the doctor office is talking, and hopefully the person that you brought to the office is just listening to figure out what the next move is for you, because right there you're not thinking about what's the next move is.
Mm-mm.
You just trying to think, okay, how long do you actually have to live? Because cancer is no joke, and at the time I didn't know anything about prostate cancer. I didn't know. You hear the commercials, you see advertisement for it, but you really don't. It really doesn't hit you until you actually have to go through it, and that's when you realize, okay. And I guess for the first week or so, it's just I was just like in a really, I wouldn't say a bad place, but in a really emotional place of how can I deal with this? Am I going to be one of those people who have a short lifespan? Did it spread to other organs in my body? Um, how bad is it really? And I guess for that first month, it was just
Mm.
mind blowing that, hey, how did I get cancer? Where did I get cancer from? And you just dealing with that emotional roller coaster right there. Some days are good, some days are bad, but at the end, it's just like you just trying to figure out, when am I going to die from this?
Mm.
And that was how I felt emotionally the first month or the first couple of weeks of being diagnosed with it.
So, my question to both of you, did you seek counseling during or after everything that happened? Did you talk to anyone? Chauncey, you first.
I didn't seek counseling uh, during, but and I didn't seek counseling after. But I do know that once I let my family know, because I have a family history of it. My beloved dad had prostate; he was a prostate cancer survivor, and once I decided to start talking to family and friends, I know I felt better. And it was released during the waiting game. During the waiting game, I know that that talking about it and having a conversation with someone, about what you're going through. Maybe you're waiting for your next test. I didn't have anyone to bring in there with me, and I didn't have prostate cancer. But typically, a lot of times, not every man has a spouse or has someone that's even going to encourage them to get the test. I didn't get it until I was initially 54 years old. Even though my dad had it, I still didn't. I didn't get the test. So that's why I believe that it's important for us to have this conversation and to encourage men to have the exam. And if you need someone to talk to, I probably should have talked to someone. I probably should have reached out to speak to a therapist or somebody during the waiting game, because of the different emotions that I went through. And I know if I went through it, I know there's other men. And then sometimes, men will talk ourselves out of the follow up appointment until we really, really feel bad. So I do believe it'd be a good idea for men to encourage men to talk to somebody.
How about you, Damon? Did you talk to a therapist during or after?
Um, During, no. Afterwards, no. I talked, well, um, I wouldn't say a therapist, but my doctor recommended a men's group. He gave me a numbers to a guy who hosts a men group of men who have prostate cancer, afters who have prostate cancer, who are living with prostate cancer, who had the surgery, and I spoke to him, and they have meetings, and I went to two meetings, and basically it's just a group of men just talking it through about their um about what they're going through, about how they're dealing with it. The ones that are with that has it, and the ones that no longer have it because they had the surgery done. Um, I think the first meeting is about 10 to 15 of us, and I think out of 15 of us, I think there were two black men there.
Mm.
So
Hmm.
it, one thing with that is that, like the doctor said and other gentlemen said, black men don't like to talk about
Mm-mm.
that. It's just something we don't talk about. We it just when we talk about it, it just shows us as a sign of weakness.
Yeah.
And as we are brought up, especially if you're brought up in the 60s, 70s, even the 80s, you're told not to show weakness and not to show emotions and not to share your feelings. And when you share your feelings, you're seen as weak or a sissy or something to that nature.
Mhm.
So it's just like you have that you're stuck with that mental state that not to talk about it, not to share your feelings, not to show other men that, hey, I'm having an emotional time right now. And
Right.
you can't tell your woman because you don't want to look weak in front of your woman. So you can't tell your woman. So there's no one you can really, especially black men, there's no one you can really talk to about it. So basically, you just put it in a box inside somewhere and just hope for the best.
Oh man.
And I think that leads to why most black men have some kind of emotional issues because we have no way, we're not taught to talk about our issues. And especially this type of issue, especially live with life or death, when we need to speak to someone, whether it's a therapist or even one of your friends,
Yeah.
it's just hard.
Yeah.
And I guess for me, I was in that same boat. I didn't know who to talk to. I didn't know who to talk to. Especially a therapist didn't even cross my mind, let alone speak to one about that. Because I mean, you speak to a therapist, you think it's because you're having some kind of mental breakdown, not because you're having a hard time dealing with the fact that you have cancer. That just
Right.
never crossed my mind.
Right. Right. So we have three questions. Questions for Anisha, and two questions for Dr. Vince. First question is for Arnisha. Listening, well, I'm going to say all three questions so you guys can think about the questions that I'm going to present to you. Arnisha, listening to Chauncey and Damon, geez, that is a lot to take in about our African American men. What is your conclusion? Just listening to the both of them. And Dr. Vance, listening to Chauncey and Damon, how many African American men actually come into your office and you tell them, you do have prostate cancer and, these are the tests that we want to do? How many, what is the percentage that actually come back to follow up with you? Number one. Okay. And then Tammy Braswell has a question. What makes men a high risk? Is it genetics, such as the guest who has the twin had it? Is it more diet related, smoking? I don't know if you can see those questions, Dr. Vince, that's on the screen. Can you see them as well?
I can see Tammy's question. I can't see the other ones.
Okay. All right. So I'm going to pose that question to you first. Arnisha, please.
So it's heartbreaking because we still in our community, we it's so much stigma around mental health still. And people do still associate it with I'm having a nervous breakdown, I'm out of my mind. But that's not what mental health is about. It is about creating a space to be okay with not being okay.
That
And whatever that looks like, it is a safe space for that. And reminding that person that while their diagnosis belongs to them, they are not alone. and walking through that process with them. Because here's the thing, like I heard Chauncey say, like, I had all this stuff built up, all these emotions. Well, those emotions, when we have them built up, you're either going to implode or explode. And so we know the body keeps score. So the more we're holding on to these emotions, the more we're creating other problems within our bodies. But when we release them and talk about it and give people an opportunity to give you what you need in that moment, and that's love, support, then you begin to heal not only better, but differently.
Yeah, very true. Dr. Vance, question number one, the follow-up. When you give that information, what is the percentage of the men that actually come back?
Yeah. So, me personally, my patients, I have a high follow-up rate. But this is in part because of something that I think is extremely important, and that's the fact that we need to diversify medicine. So we need more Black men and women as physicians that are in these spaces that can have these conversations. And so, you know, I, I'm not trying to make it sound like I'm a unicorn or anything like that, because I feel like if I could do this and become a physician, then anybody could. But the fact that for the vast majority of men who see me, specifically Black men who see me, I can communicate with them on a heart to heart level, right? Where for the majority of us, like I'm able to say, like, look, I come from where you come from, right? I understand exactly what you're feeling. And I sincerely have an interest in you doing well. And so because of that, I think that part alone, because I've heard it several times, you're the first doctor I've ever seen that I could actually connect with, right? Like who understands exactly the things that I'm going through on a day to day. So I think that part allows people to come back and follow up. The other thing is that I heard Dave. I'm sorry. Is your last name Wes?
Yes.
Okay, I heard Mr. West say that one of the things that he was really concerned about when he had his first had that diagnosis was how long am I going to live? And so that's one of the first things that if I'm bringing somebody back to tell them about a prostate cancer diagnosis, I have all my ducks in a row and I'm telling them like, look, I want you to know that the bad news is that yes, we found prostate cancer. The good news is we found it early, and this is not anything that is immediately threatening to your health. And while I gave you a cancer diagnosis, I'm not telling you to get your ducks in a row because you're going to die in the next year, right? And when you relay that information and relay that this is very treatable, you're going to live for another 10 years, and this is not going to be, Lord willing, and this won't be anything that trips you up. Then people can step back and take a big deep breath and be like, okay, talk to me about the treatments. Now I can start to listen and comprehend everything you're telling me because I'm not worried about if I'm gonna die within the next year or not, right? So I think for those reasons alone, and there's others, the follow-up from my clinical practice is pretty high.
All right, and to answer the question from Tammy, what makes men a high risk? Is it genetics, such as the guest who has a twin, who's had it? Is it more diet related, smoking? I mean, we answered that a little bit earlier, but I think that Tammy came on a little bit later. If you just want to touch on that real quick.
Yeah. So, I think it's important to distinguish a couple things really quick. So, if someone is diagnosed with prostate cancer and they're considered high risk, high risk is how likely is the cancer that you were diagnosed with to spread outside of the prostate, right? To spread to other areas. So, if it is the more aggressive form of prostate cancer, then you now have high risk prostate cancer. So that's different. That's after diagnosis. Before diagnosis, someone could have a higher risk of forming prostate cancer if they have a family history or like we talked about obesity, hypertension. You know, the other thing that some organizations, and you may see it on their website, is, you know, they might say if you're a Black man, you're at higher risk, right? And so that's also, now I have I have certain feelings about that, like if I'm being honest, because I don't like that whole blanket statement about like, because and historically within medicine, rather than addressing like a lot of the societal issues and mistrust and, you know, lack of treatment and the poor quality of treatment that leads to a lot of the differences in outcomes.
Yes.
Historically within medicine, they'll just say, oh, well, this person is Black, so they are more prone to die from this disease. So, you know,
Yeah.
it's something they were born with because they're Black. So I feel a certain type of way about that. So I don't, yeah. So most of the time, if you ever hear me give a talk or anything, I'm not even saying anything about Black men just necessarily being at increased risk, because that's lazy. There's other issues that lead to this differences in outcomes. So
Absolutely.
That's the answer to that question.
Absolutely. Arnisha, I believe this question is from you, for you. This is as well as from Tammy Braswell. As a mental health clinician, what can I do to create an atmosphere that will draw men to come and talk about this issue, especially during the waiting period?
So I think that a lot of times it's one, just, I want to say more than about the issue, just creating, just getting an atmosphere to draw men into talking about mental health in general. Because, and then the rest of the stuff will come up. Because if we create the environment and destigmatize the notion around mental health with men, then all the other stuff comes in with them. And so I think that just making sure that we understand and our men understand that it is okay to talk about how you're feeling, because this has gone on for so long and we have so many of our men that are just so angry. And it's not about so much of what's going on in the world, but just like there's so much going on and life is hitting at every aspect. And then on top of that, I hear I have cancer. So if we can just get them to start talking, creating an atmosphere. I heard Damon say that when he went to the support group, it was maybe him and two other brown men. We have to let's create these men's groups around mental health, and then I can guarantee you all this other stuff will come up, and then we can start making smaller groups around these specific issues.
Can I interject one thing really quick? I'm sorry.
Absolutely. No, go ahead, please.
You know, that just brings me to something that we're trying to do here within Cleveland, because, you know, whether you're in Baltimore, Cleveland, Detroit, New Orleans, you pick a city, Philly, like DC, you got the same issues, right? And so one of the things that, you know, we actually did a survey, and one of the things that a lot of men say, because this is directly specifically for men, is that they feel like they want to have that men's group, right? Like where they can come and talk to other men who might be going through the same thing they're going through and really get some insight. So, you know, I think you just hit the nail on the head when you said, you know, having these groups where people can come and talk about, you know, the experiences they're having. And it's like in a judgment-free zone, and it's a zone where people are being very open and transparent with each other. And that in itself takes a little bit of a mental transformation, if I'm being honest. Like, yeah, as a physician, you know, and somebody who recently started going to individual counseling, it took a lot for me to start opening up to my counselor. So, you know, I think that in itself is a mental transition, but it's definitely something that's needed.
You know, I want to say something. I mean, I don't know if Chauncey want to elaborate on this more. Last year, we were, Chauncey started he's a trainer. He's my trainer, one of the best I've known. And he started to do like free workouts for men, you know, start like a men's group, because he has groups, and it's all women, because we're strong like that. You see my guns. And we call ourselves Chauncey's Angels, like Charlie's Angels, because we're tough. you know. So we had a few men, we call them Chauncey's champions, but they're very small in number, but we're large in numbers because we're females and we're strong. And like I say, you see my guns. No, I'm gonna start with the guns. But anyway, Chauncey, he does a lot of things in the community, number one. Okay. And he tries to bring men into the gym to talk about these kind of things. He talks a lot. Politics is one of his little claim to fame, you know, but prostate cancer is one of his babies as well, you know. And he really has been pushing prostate cancer this month so hard. He pushes on everybody group page, and I really want him to talk more about how he tries to, and I hope that he really starts that up again. I'm going to put his information up here, and maybe he might even try to start up a every Monday. I don't know. You was doing it every Monday, Chauncey, with the men.
Right, right. But before I go into that, I wanted to piggyback and I want to ask Dr. Vince a question. Is it related to, we were talking about, Tammy mentioned the waiting period. I have a question. When a patient comes in and the patient, you see that they have elevated PSA, and you're going to schedule them for biopsy or something like that, or whatever you feel the need is. How long is that process? Typically, what's the waiting process? Is it weeks? Is it 5 days? Or is it a month to get that biopsy scheduled? What is the process?
Yeah. So I'm gonna try not to give you a long-winded answer, but it varies. And so a big part of it is historically or traditionally, should I say, if someone had an elevated PSA, you just proceed straight to biopsy. Now with the increased tools that we have at our availability, most men will get an MRI, and that MRI is to help the physician who will do the biopsy really see if there's any areas that they should sample more than others. And so that process can take a few weeks because you have to get it scheduled with the radiologist, get the MRI, and have them read it, and then get the results back before the procedure even takes place. So it's usually a few weeks.
And that is where I find that it's very important for that patient, that black man, to talk to someone, because during that waiting period, typically, Dr. Vince, we're not going to talk to anybody because we don't know. And that's the part where you start questioning yourself. Do I talk to someone? I don't know if I have it. Should I tell somebody I'm in that waiting period? What do we suggest from mental health to when you're in that waiting period? You don't have to wait along that 1 week, 2 week, that 3 week, because it can eat you up inside because you don't know. You don't want to put that burden on someone else to be waiting either. You say that to yourself. So how can we deal with that waiting period? Because it varies. If you're with the VA or you're with somewhere, it may be 6 weeks. So how do we get our men to understand that, look, during that waiting period, whether you know or not, which can be a very, very scary time, that's when we need to reach out to talk to someone. And I'm talking from experience. That's that part, because you don't want to say, I don't know if I got it. I do have it. You don't know. But I don't want men to go down that rabbit hole and suffer in silence, that they need to be aware that there may be a waiting period. And during that waiting period, maybe you should seek that men's group. That's what I was saying.
Yeah.
That's a great idea.
Yeah.
And as a shade to the men, it's great. Men always, I get it. We want to have groups to go to, but wanting it and actually showing up, Dr. Vince, is two different things. Because I'm going to use an example which Shay walked us into. We had a men's walk, and I invited every single man. We had maybe about 75 black men out, men of color. I invited every man to a free workout every Monday, and I had one man show up. Everyone says they want that, but trying to get us to do that is a whole nother. I don't want you to do the workout when you're overweight and you need to do it. It needs to be part of what you need to do. I don't want you to seek the counseling for your while you're in the PSA. Maybe you need to start. Maybe you need to have counseling before you even go to the doctor as it relates to that. So I want to try this to not only just talk about it, but actually do it and be about it. That's the hardest part. Everyone says they want to work out. Everyone says I want to talk to someone when I have an issue. But do you really go ahead and do the follow up and do it? Because if we started a men's group today, I hope that all these men would show up to have a conversation about prostate cancer, PSA, or show up for the fitness. But my experience is it'll probably be one or two individuals. That's good enough for me. But I just want to try to get men to look at their health and become more involved before it's too late, before they are diagnosed, before there's like, hey, this is your stage. There's nothing I can do. So whatever I can do, Shay and anyone, I'm willing to do it.
Okay. So we are coming to the close end of our show. Geez, this was very, very, this was a very good show. I hope that everyone learned a lot. I really did. I learned a lot about men's mental, which is so important during this process of the waiting period.
Yeah.
As physicians, we are so in tune with those numbers and getting the patient taken care of. We don't focus on that mental as much. I know I don't. I mean, I'm guilty. So every session, I'm learning something new about how to better take care of my patients. So I thank you so much for this. Those that are interested in services with Chauncey the trainer, I have his information here on the screen. He is at Mission Fit Gym at 2720 Session Street here in Baltimore. His telephone number is 443-447-0705. He gets up as early as 4 o'clock in the morning. I know because I was there at 5:30 this morning, and somebody was there at 4:30 this morning, an hour before me. Okay, so I know he has to go to bed very soon because he is going to be up very early in the morning again. So Chauncey, thank you so much for coming on the show. I really appreciate you, sir. We also have Mr. Damon West that is also doing great things in the neighborhood. Mr. Damon West, he is also an advocate for Dyslexia Awareness Month. Damien, do you want to tell us about that, sir?
Basically, basically, it's a foundation called Dyslexia Advocation, and October is Dyslexia Awareness Month. And basically, what dyslexia is a learning disability. When children, it starts off with children who have issues with reading, and a lot of black men, a lot of black kids, especially black men, have issues with reading, and because of their issues, they're diagnosed as troubled or um, troubled in classrooms or having some kind of issues in the classroom. And it usually grounded out, and it's usually the reason because of it because they don't know how to read. Um, you see it more in black kids than you do females, but as far as our foundation is concerned, we basically help kids in Baltimore City, provide them services where we can help them find tutors for to help them find tutors to help them learn how to read. And basically, that's what I pretty much will be promoting next month, along with prostate.
Wonderful. So you know what? We would love to have you back on the show for next month. Okay, we will have some doctors, pediatricians on the show for next month. Okay, talking about dyslexia. All right, if that is okay with you, sir.
Well, I recommend that you have the CEO on.
Oh, okay. Well, we will get connected, but
Yeah,
I will have some pediatricians on next month. All
yeah,
right.
okay.
All right, that sounds wonderful. And then we also have our lovely therapist who was with us last week, and she was so wonderful to stand in for us again. Mrs. Arnisha. Arnisha, you want to tell us about the services that you have, and if anyone would like to follow up with you to seek any type of therapy?
So yes, I am currently practicing in a private practice I'm sorry, outpatient mental health clinic with Transformation Health. So I can be reached there, and that is located in Baltimore City. And my work cell number is on the screen. And so for more information about my personal private practice, you can certainly reach out to me on that number. And don't talk yourself. I just recommend that people don't talk themselves out of the conversation. That mental conversation with yourself can be very damaging. So thank you, Chauncey, and thank you, Damon, for just being open and willing to talk about this.
Wonderful, wonderful, wonderful. And Dr. Vince, I thank you, sir. I thank Dr. Burnett because I was twisting his arm. I don't know if he told you or not, but I told him that I'm persistent, I'm aggressive, and no one can tell me no.
Yeah, Dr. Burnett is in our field, he's sort of a giant. But it was a pleasure to be here tonight. Like I said, I told you this when we talked over the phone. Anything I could do in the service of my community, I'm willing to do. So it was a pleasure to be here tonight. Couple things I just want to say before we end. I feel like part of the reason why we don't get a lot of buy-in from Black men is because we talk a lot about how we want to do things, what we want to do, but we don't really emphasize why it's so important. Right. So that's one of the things with community outreach and engagement that is very serious to me. Is I don't want to come and tell you what you should do and how you should do it. The first thing I want you to know is why, right? And so when I tell you why, and you can see that it's very proximal and close to you and your experience, then you're a little more likely to hear me out when I talk about, what you should do and how you should go about doing it to improve your health. Because I tell you what, a lot of the experiences that we go through are automatically going to put a lot of stress on you, and that can impact you physically. So, these other things that we're talking about in terms of medical conditions and medical diseases, just kind of add on to that. And so for a lot of men, as we age, there's certain things that I know as a Black man are very important to me that are important to a lot of other Black men. And so I'll always lead with why and then go into how and what beforehand. So, and that tends to get a lot of buy-in.
Thank you, sir. And I'm going to end this with myself. I am an obesity management specialist. Anyone that is interested in a free consultation, you guys can find my information down at the bottom of the screen. It is sbbfitforlife.org. You can contact me on my website. Go to the contact bar, sign yourself up for a free consultation. I am asking that everyone please go to the YouTube channel, type in SBB Fit for Life, and subscribe to my channel. Okay, I'm trying to get over 1,000 views. Why? Because if people can get 1,000 views about people eating a bunch of food, then we can get 1,000 views about trying to promote people to have better health. Okay, trust me. Those people need to be on here listening to us talk about better health after eating all of that food, okay? So, again, those that are interested in seeking help with managing their obesity, hypertension, diabetes, definitely go to my website, schedule yourself for a free consultation. Consultation is about a half an hour. If you need an assessment, I either come to you or you can either come to me. Either or. Here in the state of Maryland, I don't do outstate just yet. I'm trying to get myself certified. I will get there, but I am trying to reach as many as I can because this is important to me. In the doctor's office, Dr. Vince can tell you, we're only allowed 15 minutes, okay? 15 is all they give us. But here, we're trying to give you as much as we can, all right? So take advantage of us, all right? So we are going to end this podcast, and I just want to tell you guys, God bless. Take care of each other. All right. Guys, please stay on the line for a little bit. Just want to give you thanks. All right. All right. Take care, guys. Bye-bye.
Peace.